I'm really grateful to all of you. Thank you for that generous introduction. And I am really honored to be recognized by this great organizations, the Dental Trade Alliance and Oral Health America. I want to give a shout out, even though he's not here, and I just found out he retired about a month ago. Brad McLaughlin, who some of you may know from Chicago, is a great friend of mine, and actually talked to me about coming here several months ago. So I'm really happy to be here. And Vern told me that now he has time on his hands. I should call him as a volunteer, and I will. Thank you for that. I want to give a special shout out to Oral Health America in Chicago, and grateful for its outstanding work and advocacy efforts for Smiles Across America, which reaches school-aged children, and for the Wisdom Tooth Project, I love that name, which is addressing the oral health care crisis facing older Americans, and it really is a crisis. I want to thank and congratulate Dr. Edelstein for receiving the Barbara Goldstein Award and for creating the Children's Dental Health Project almost 20 years ago. And I want to thank all of you for focusing on improving oral health care. Just a second. It's not the White House, I'm sure. And so I'm not taking it. As Donna Butts has pointed out, the need for oral health care is not a red or blue issue. It's an issue of critical importance to all generations, young and old. And oral health is health. Period. End of story. It's not a luxury item or an add-on service, and it's time we stop treating it that way in anything we do. The failure to get good dental care can have enormous lifelong consequences, from poor nutrition to diabetes to heart disease. The lack of oral health affects the quality of life, and it can actually shorten life. We've made a lot of progress in expanding access to children's dental services through Medicaid and the Children's Health Insurance Program and the Affordable Care Act. I'm happy to say that a survey released earlier this year found that 43% of children 3 years old and younger in my state of Illinois had never been to a dentist. The American Academy of Pediatrics recommends that children visit their dentist at age 1. And the failure to receive oral health is harmful to our children. A study that was released last month by Delta Dental Plans found that 30% of children ages 6 to 12 in America misses more than altogether 9 million school days because of oral health problems. And of course, it's not just children who are affected. Adults with poor oral health not only face medical problems, but they may be disadvantaged when it comes to employment. Captain, you take my phone and drown it or something? I don't know. Okay. So I got a call from a constituent last month, and it was really sad. She was asking about the upcoming cost of living adjustment of Social Security, which is non-existent, and Social Security is her sole source of income, and she wasn't interested because she wanted to go on some vacation or she wanted to buy new clothes. She wanted to know whether she would have a little bigger check so that she could afford to get the root canal that she needs. And it turns out she had a number of other health problems, including the need for an implant because she had lost many of her teeth. And her ability to get the care that she needs is posing a threat not only to her physical health, it's causing her to become socially isolated. She told us she wasn't going to church anymore because she was embarrassed about her appearance. These problems aren't insolvable. I mean, they are absolutely preventable, and we know what to do. So let me just say right now that we should expand Medicare coverage to include oral health and make it a guaranteed service. And we should also do that for children and adults in all public and private insurance. We should create the robust oral health workforce we need to be sure that we can provide services, including visits to older and disabled Americans in nursing facilities, or who are homebound, and more school-based programs as well. We need to promote healthy diets and dental care practices, and we have to accelerate medical research to provide new, improved tools and treatments. And I really look forward to continuing to partner with you. I had Kathy take my phone, and I want to say that Kathy, as many of you know, is such an incredible partner to me, really, to learn the truth, the brains, and the operation, and there's Kathy Herman. So let's thank her too. I really appreciate it. Partnered with so many of you, and Ronnie from Families USA. I want to thank you for years and years of work to improve the lives of older Americans, which has really been very much my life's work. But as I said at the beginning, it's about all generations of people. It's about healthcare, because oral health is healthcare. So we'll continue our struggle together to make sure that everybody is covered. And let me just, as a last word, I'm not going to try and get too political, just say elections really matter. Thank you.